the make or break thing will be that combination of business model and go-to-market strategy.
Yep.
And if you don't get that right, the greatest technology in the world won't make a lick of difference because it will never see the light of day.
Yeah.
And so, the part of what we're trying to do is, simplify the value chain.
Mm-hmm.
It is complex by design. And it is remarkably straightforward once you remove this and then you rebuild this layer. And so I think a big part of it, as I mentioned, the immersion is spending time with these new models.
Mm-hmm.
And so, for instance, I had been writing about direct primary care as a healthcare services innovation, starting about a decade ago. And I saw it as a microcosm of where the healthcare system needed to go. It wasn't the one silver bullet or anything, but it was an important piece.
Yep.
And there was a guy, unbeknownst to me, who said, okay, that's pretty interesting. I'm going to go into these practices that are doing this and see what their problems are. And what were they doing? They were, because it's a membership model, rather traditional primary care is all about, billing and volume and referrals and all that. What were they doing? They were like using Excel. They were using gym membership software because they had this monthly membership. And then they trying to sell to employers, and some employers would cover the member or 80% of the employee and maybe a family member. And you got into it, it's like, wow, there's all this nuance there.
Yeah.
And so this is a company called Hint Health. So they said, gosh, we're just going to build that. And so they become basically the operating system for, in that case, payment and eligibility, which seems like it's really simple because it is a more simplified model, but there's still quite a few nuances. You still have to verify eligibility in these models, even though, you remove the 40% insurance bureaucracy tax. So you have that type of thing where go in, see, at the end of the day, it is about the interaction between, patients and clinicians. And if you go in, study those new models in a particular area that's relevant to you, it could be in, pharmacogenetics, it could be in a technology thing. Those things then reveal the problems. And that's a big, Steve Blank is well known as sort of customer development and lean startup, stuff. And then, he's always about get out of the office, get in there, go in with your hypotheses. But a quote, I think it's from Mark Andreessen, he says, have strong opinions weakly held, and be ready to be proven wrong. And so that would be my advice, is to you really get out there and I keep harping on. There's a lot of problems. You just have to figure out what's the problem space that I can be focused in on, and you can stay quite focused.